This is the reality in Atlanta. Within the last 24 hours, our access to emergency health services, it has been snatched, and experts are warning we're all in trouble.
Yeah, this fallout is ugly following the closure of Wellstar Atlanta Medical Center, set to happen very soon. There is not much time to find a plan B for health care. 61 days, 2 months from today, the hospital in Atlanta's old 4th Ward neighborhood will close its doors for good.
The crisis made worse by Atlanta's lack of hospitals that are designed to deal with major trauma. Wellstar AMC is just one of 2 in the metro.
Zach Summers begins our team coverage. He's live at Wellstar AMC. And Zach, you're getting some very real perspective about the impact, not only on patients, but on the entire state.
Yeah, you know, we often hear about hospitals closing in rural areas, but health professionals tell me there is no playbook for a situation like this. They say Atlanta nor the state is prepared to lose a level 1 trauma center.
It's definitely not putting the patient first.
For years, Atlanta Medical Center was Vincent Pearson's primary hospital. 64-year-old doesn't know what he'll do now that the level 1 trauma center is closing on November 1st.
I'm just trying to figure out what do they have in place to, like a safety net to help all these people who are going to be affected, like me.
While patients scramble, health professionals are bracing for the impact the closure will have across Georgia.
The ripple effect across the state is going to be pretty dramatic.
Liz Atkins is the executive director for the Georgia Trauma Commission. She says Atlanta already absorbs a bulk of the state's trauma patients. With AMC gone, that leaves the state with just 4 level 1 hospitals. Grady in the metro, which is routinely overcrowded, Macon, Augusta, and Savannah also have level 1 facilities.
We simply just don't have enough space to take care of everybody, and trauma beds are even more, even a more scarce resource than hospital beds.
No one knows that better than Dr. Dennis Ashley, director of trauma services at Atrium Health Navicent, the level 1 trauma center in Macon. His hospital periodically intakes Atlanta patients when AMC and Grady go on diversion.
Even with both level 1s, Atlanta is very tight on access to trauma care.
The Georgia Trauma Commission, which Ashley chairs, supports trauma-designated hospitals, generating $23 million annually through super speeder fees and firework taxes. But Ashley says that's no longer enough.
Somewhere in the $80 million range is where we need to be, to where it would be reasonable to cover everything that we needed to cover statewide for our trauma system.
And the Georgia Trauma Commission, they're working to collect more data so they can better understand the true impact this closure will have and to share that information with regions across the state. We're live in Atlanta's 4th Ward. Zach Summers, CBS 46 News.